Welcome to Hear Us Early, a podcast amplifying lived experiences in child and adolescent mental health. My name is Promise Taiwo and I'll be your host. Your host. Hear Us Early is a space where we center the voices and lived experiences of children and adolescents and exploring why it is essential for us to listen to them early in order to have better mental health outcomes. According to World Health Organization, 1 in 7 adolescents that is aged 10 to 19 years experiences a mental health condition, and about half of all mental health challenges begin by the age of 14 years. What this tells us is simple but important. Today, many adults that experiences mental health challenges often had actually started experiencing this way much earlier in their childhood years or adolescence. This is why listening early is so important. Today, I'm joined by Dr. Uthman, a mental health professional, to explore why listening early is essential in mental health care for children and adolescents. Dr. Uthman, you're welcome. Thank you for joining us.
Okay.
Could you briefly introduce yourself and your work?
All right. Thank you for having me. So I'm Dr. Utman Babatunde. I'm a medical doctor with experience in mental health care, particularly in understanding the emotional and behavioral concern among children and adolescents, as well as supporting an early identification and intervention.
Wow, that's so impressive.
Thank you.
All right, so from your experience, what are we often missing when it comes to understanding the mental health of children and adolescents?
Okay. So one major gap is that we often focus more on observable behavior than on understanding the underlying emotional experiences of children and adolescents. Many young people are not given enough space to express what they feel in their own words, and adults often overlook subtle signs such as withdrawal, mood changes, or changes in behavior. So what is often missing is intentional listening.
Intentional listening.
Yeah.
Wow. That's a very important key point here that we need to understand. So, intentional listening is something that we often miss out while actually observing our children or
Yeah,
adolescents.
exactly.
Okay, so that moves us to the next question. Why is it important to listen to the lived experience of children and adolescents early?
Okay. So, listening early allows us to identify concerns before they develop into more severe mental health conditions.
Okay.
Childhood and adolescence are critical developmental stages, and early emotional experiences shape the long-term well-being of these children and adolescents. So, when children feel heard early, they are more likely to seek help, trust caregivers, and develop healthier coping mechanisms.
Oh, that's actually true. Thinking of looking at it from the last statement that you shared, that it will actually help them to seek help early because they were paid attention to
Yeah.
way earlier. Okay, so but looking at it now, what happens when children and adolescents are not actually even given the space to express their lived experience?
Okay. So in situations where they are not
Given
given
the
that space,
space, yes.
when the early signs are ignored, then
Yeah.
emotional distress can become more complex over time. It may
Mm.
lead to increased anxiety, depression, behavioral challenges, or even difficulty in relationships. Additionally, young people they may learn to suppress their feelings, which can make it harder for them to seek help later in life when they are adults.
I'm looking at it from this angle, that what actually happens when children and adolescents are not given that free space to actually experience or express, rather, to express their lived experience.
Okay, so in situations where the young people are not given that space that they require to express their emotions, their lived experiences, and then these signs are ignored, emotional distress can become complex over time as they grow. It may lead to
Okay.
increased issues like increased anxiety, depression, behavioral challenges, as well as difficulty in relationship, as with their family members, with friends. So they have
Mm,
difficulty maintaining such relationships and
relationships.
building it. Finally, also, young people, they can learn to suppress their feelings, which can make it harder for them to seek help
Yeah.
later in life when they need it.
Oh wow, wow. So when they actually have that space to open up, they
Yeah,
actually get to suppress their emotions.
exactly.
Oh, that's why it is important for us to actually give them the space to open
Intentional.
up, to speak up, so that whenever they are experiencing such distress or whatever challenges that they are quickly noticing, they'll be able to freely speak up to the
Exactly.
people around them. That's very very helpful to learn that. So I'm going to be asking this question, which I believe our audience also be interested in knowing, that what can we learn when we actually truly listen to children and adolescents in their own words? When children and adolescents, that they are still growing up, that's like an early stage of development and growth before they become adults. So there are some expressions that they share, and how do we actually show that we can truly listen to them, like give them that space to be able to listen in their own, listen to what they share truly in their own words.
Okay. Yeah, just as you said, it's very important that we give them that listening ears as in a way that will be helpful to them, not just from our own end.
Yeah.
So we can do this by creating safe, non-judgmental spaces where they feel comfortable expressing themselves. So when they're expressing themselves, however you feel about it, you don't pass judgment, you listen and let them express fully in their own way. Whatever opinions you have about it, whether sentiments, you have to hold back on it while providing that active listening. So it includes also asking open-ended questions. That's when they give you a, you ask them, give them feedback and ask follow up.
More probes.
Yeah, you probe further
Okay.
to get a better understanding of what they are trying to express to you. And then also taking their concerns seriously is also important. Yeah.
Yeah.
So when they express a concern, even though it seems as an adult, it seems flimsy to you, you want to take it seriously because what they are expressing is from their own perspective. So you show that empathy and
Yeah.
yeah, take it seriously, hold the weight that they pass on whatever they're expressing. Then also, what will help is adapting our communication to be age appropriate. Because I
Oh
mean, when
wow.
we are talking of children and adolescents, they are not exactly the same thing. Children
Yeah.
are way younger, and adolescents have better understanding of whatever language you are speaking to them. So you have to
Okay.
use age appropriate language for each of these demographics you are talking about and
Okay.
ensure that they feel respected and understood
Okay.
at whatever point you are meeting
Um,
them, whether as children
or
or
as
adolescents.
adolescents. Oh, thank you very much, Dr. Usman. That's very helpful. I'm even like trying to pick one three key points from what you just shared with us. Looking at it, I'm looking at the active part of active listening. That's the
Yeah,
first
active
key point,
listening.
active listening. Then actually being empathetic and respectful to them,
Yes,
because you might feel that what they are sharing sounds clumsy or flimsy, that is not important, but actually respect them and understand what they are saying, even though it does not really align with what you think. But
exactly.
meeting them, I think I can look at it from this angle, meeting them at that point where
Where
they
they
are,
are. Yeah.
yeah, very, very, very much helpful. And I like the last part where you mentioned actually the age appropriate demographics. That I think that's where that even meeting them where they are comes in, because looking at it, the way you relate with a child is not necessarily almost the same way you relate with an
Adolescents.
adolescent. Okay, thank you very much.
You're welcome.
And that would actually lead us to one the last two questions before we end up the podcast. So, looking at it, how do you think mental health professionals or caregivers or parents can better integrate children and adolescents' lived experience into the care that they give?
Okay, so yeah, this talking of lived experience is a very vital part of the mental health conversation because it provides valuable insights into what the young people, the children, adolescents are actually going through. because it gives us perspective on exactly how some of these challenges, these conditions
Yeah.
manifest at various age
Age
groups.
groups.
Yeah.
Okay.
So integrating lived experience means listening to their perspectives,
Yeah.
involving them in conversations about their care, not just giving them the care that we feel they need, involving
Yeah.
them in deciding and understanding why they need it and what
Mm,
exactly the care is all about, and
okay.
also using their experiences to inform better services and intervention. Because I mean, you have to in the medical arm from the medical angle, while giving care, you always want to get feedback to understand how efficient or how effective
You're
your
okay.
chosen care, yeah,
Oh,
is. So
okay.
you want that feedback from them. You want their
Mm-hmm.
experiences, okay, regarding whatever format of intervention you have chosen, whether medications, whether therapy,
Therapy.
exactly.
Okay.
You want to get feedback from them on how it's helping them,
Yeah.
how far they have come from where they started, to understand further intervention from then on. And
Oh.
also it helps make them more responsive, because from the mental health perspective, I
Mm-hmm.
mean, interaction is very important. Like response, feedback is very, very critical in management of it. So it makes them the care more effective and makes them more responsive to
The care you
whatever
are
care you are giving
giving.
them.
Yeah, thank you very much.
Yeah.
That's a very, very noteworthy to look at. Looking at it that we actually need to understand the care that they would prefer. So that's why we need to integrate lived experiences when responding to children and adolescents mental
Yes.
health. Okay, and that brings us to the last question. So, what is one key message, Dr. Utman, that you would love to share with professionals or caregivers that are listening right now? What is one key message you would love to share about them being intentional in listening early to their children or adolescents?
Okay. So a very important message I would like to share to
Okay.
the listeners, healthcare professionals,
Caregivers,
caregivers, and
parents,
parents
yeah.
around is that was the first message that we passed in this conversation, which is intentional listening. Is
Okay.
very, very important when it comes to the young people we are talking about, the children and the adolescents. Listening to them intentionally is very vital. You have to be actively listening to them, listen from their perspectives, ask follow-up questions, and always like don't be judgmental. Yeah, when
Mm.
talking to them about it, get feedback from them. Pay attention to whatever concerns they might have. Don't discard their concerns from your perspective. I mean, as an adult, you have been through a lot, so we tend to like understand, see some things as part of life. Meanwhile, at a certain age, is that's crossed that barrier. It's not like a challenge. It's no longer just irregular. So you have to like pay attention to them and show concern at whatever level you are meeting them at. So
All right. Now that's very, very, very important for us to take home from today's conversation that actually we need to ensure that we are intentional about our listening to our children, our adolescents, and also create safe space, non-judgmental listening. Thank you so much, Dr. Utman, for sharing your
yeah,
insights. And I would love to actually say that what has actually stood out for me from this conversation is that early listening to children and adolescents, especially concerning their mental health, is not something optional, but it's something essential for every one of
exactly.
us. And we also need to integrate the lived experiences of these children and adolescents while offering mental health care or support to them. And this is what Yale's Early is all about. It's all about creating safe spaces for voices that matter among the children and adolescents early enough to make a difference even in their mental health. Thank you for listening.
Thank you.